Welcome to the Newborn Behaviours and Needs Education session. Today we are going to discuss how to care for your newborn and what to expect. I will be teaching you about their feeding and sleeping patterns, swaddling and safe sleeping methods, safe car travel, baby baths, changing nappies, dealing with sore and windy tummies, and strategies for settling a crying baby. Information will be provided on immunisations, newborn screening tests, and how to bond with mum and baby during separation. You will receive a lot of information today. Please review and revise at your leisure. Breastfeeding is considered the best option for feeding. It offers optimal nutrition that supports normal growth and development. The first milk that is produced is called colostrum. This thick yellow substance is highly concentrated and easily digested. Your baby only requires small amounts of colostrum each feed to fill its small stomach. Between days 2 and 5, your partner's milk will begin to change. It will increase in volume, water, fat and calorie content to meet the individual needs of your baby. Establishing breastfeeding can be difficult and tiring for a new mother, and you need to be supported during this time. Feeding is not quick in the early days, and a feed can last anywhere from 10 minutes to 1 hour. Your baby will feed frequently, usually 8 to 12 times in each 24-hour period. Your baby's feeding technique and weight will be monitored to ensure it is getting enough milk. Babies use cues to communicate their needs. These cues signal how the baby wants to interact with you. Your baby will exhibit feeding cues when they are hungry. If you focus your attention to the current slide, there is a pictorial version of infant feeding cues. You should familiarise yourself with these. When your baby is telling you, "I am hungry," you will see them stirring from their sleep, opening their mouth and turning their head. This is the time you would prepare your baby for a breastfeed. The mid cues are your baby telling you that they are really hungry. You will see them stretching, increasing their physical movement and putting their hand in their mouth. A breastfeed should be commenced immediately to avoid your baby becoming distressed. The late feeding cues see baby becoming very agitated, crying and turning red in the face. It is important that you calm your baby before attempting a breastfeed. This can be achieved by cuddling, doing skin to skin, talking softly and stroking your baby. Keeping your baby close will allow your baby to signal to your partner their desire to feed. This is called responsive feeding. Sleep is an important factor for the development of language, memory, executive functioning, attention and behaviour. Sleep patterns in the newborn and throughout early childhood are ever changing. Understanding and responding to the needs of your baby can be challenging. Be reassured that unsettled sleep-wake behaviours are normal in the first 6 months. A normal sleep-wake routine for the newborn is feed, play and sleep. Once your baby has fed, they will often play with you. This may be in the form of eye contact and movement. This period is very short. After the playful period, your baby will display tired cues. Pulling ears, closing fists, yawning, fluttering eyelids, jerky arm and leg movements, arching backwards and sucking on their fingers. If you notice these cues, you should prepare your baby for sleep by swaddling, cuddling, turning off the lights and placing your baby into the cot. Swaddling your baby can help to reduce crying and stress and induce deep sleep. It is thought that swaddling your baby helps to recreate the restricted space within the womb. Although swaddling is helpful for settling your baby, it is important to remember that swaddling needs to be done safely. When swaddling, you must practice safe sleeping strategies, which include sleeping your baby on their back, not being too restrictive with the swaddle, and not overheating your baby. I'd like to draw your attention to the pictures on the slide, as I will now teach you how to swaddle your baby. Using a lightweight wrap, fold the top edge down. Lay your baby's shoulders in line with the fold. Next, place one hand under the fold and then bring the wrap across the body, tucking the excess under the baby's legs. Repeat for the other side. Make sure the wrap is snug, does not restrict movement or breathing, and is clear of your baby's neck and head. Safe sleeping has been shown to decrease the risk of sudden infant death syndrome in the newborn. SIDS is the unexpected and unexplained death of an infant within the first 4 months of life. Although researchers have been unable to identify the cause of these deaths, they have highlighted some simple measures for parents to follow that reduce the risk of SIDS. The Red Nose Organisation recommends 6 ways to sleep baby safely to reduce risk. These are: 1. Sleep baby on their back. 2. Keep head and face uncovered. 3. Keep baby smoke-free before and after birth. 4. Provide a safe sleeping environment night and day. Safe cot, safe mattress and safe bedding. 5. Sleep baby in parent's room. And 6. Breastfeed your baby. Transport injuries are the leading cause of death and injury in children aged 0 to 14 years. In Australia, it is illegal for any baby or child under the age of 7 to travel in a car without being adequately restrained in a correctly fitted, properly fastened car seat. The new child restraint laws state that newborns and infants up to 6 months of age must travel rearward facing. Bath time is a lovely time for you and your partner to bond with your baby. Before you start, collect all the things that you will need and put them within easy reach of the bath. This might include cotton wool, washcloths, towels, lotion, a clean nappy and clothing. Fill the bath using a mixture of hot and cold water. You are aiming for a depth of 10 centimetres and a temperature of 36 to 37 degrees Celsius, or warm to touch. If you are unsure, use a bath thermometer. Before unwrapping your baby, clean baby's eyes by moistening a cotton ball, wiping from the inside of the eyelid to the outside. Discard cotton ball and repeat on the other eye. Once you have undressed your baby, cradle and support her head and shoulders with one hand while supporting her body with the other. Gently lower her into the bath, softly washing her face, neck, arms, body, legs and genitals, ensuring you wash in all the creases of her skin. Hair only needs to be washed once or twice a week. Remove your baby from the bath and dry thoroughly, ensuring you keep her warm and covered. Remember, never leave your baby alone, even for a split second, in or near water, as they can drown. Changing nappies is a great way of monitoring the overall health and well-being of your baby. Wet and soiled nappies are a good indicator of hydration and adequate nutrition. When changing the nappy, make sure that you have everything you need within reach, including nappies, wipes and cream. Lay your baby down on the change mat. Undress the bottom half, then remove the soiled nappy. Lift the baby's bottom and gently clean the area with baby wipes, wiping front to back. Put on nappy cream. Take a new nappy and place under your baby. Pull firmly against the bottom, then fasten it using the tabs. Fold the front of the nappy down to uncover the belly button. Redress your baby, place your baby in a safe area, dispose of the nappy, and wash your hands. Babies can move and wriggle. Never leave a baby unattended on a change table or bed when changing a nappy. Sore and windy tummies can be a source of an unsettled baby. When babies feed and cry, they swallow air. This air needs to be released as it causes some babies discomfort. Babies burp or pass wind to get rid of the air. Burping represents a great opportunity for you to be involved in the care of your baby. Some babies become very unsettled and need to be burped during and after a feed. To burp your baby, place a cloth on your shoulder. Sit or stand, holding your baby in an upright position against your chest. The baby's chin is placed on your shoulder, and you can either pat or stroke the back in a circular motion. You and your partner can modify this method to best suit your baby's needs. Other methods include sitting the baby upright, supporting their head and rubbing their back. Alternatively, the baby is placed face down on your forearm with their head facing sideways. Some babies like to be rocked, some bounced, some gently moved, and others like to be held still whilst burping. All babies cry. This is their way of communicating their needs. Crying is normal. Common reasons for crying include being hungry, tired, scared, uncomfortable, or having a wet nappy. In most cases, the cause is not a medical problem. It is important not to let your baby get too upset before responding to their cries. Follow their cues and be responsive to their needs. Try to work through the crying baby checklist to help identify the reason your baby may be unsettled. Number 1. Does your baby need comfort or attention? Hold, cuddle, talk, or sing. 2. Is your baby hungry? Follow your instinct. Provide a breast or bottle feed. 3. Does your baby have a dirty nappy or rash? Clean the area with warm water, apply barrier cream, and change the nappy. 4. Does your baby need to burp? Hold your baby upright and pat her back. 5. Is your baby uncomfortable? Is your baby too hot or cold? Adjust the clothing to suit the temperature. 6. Does your baby want to suck? Help your baby find her fingers or try a dummy. 7. Is your baby overtired? Swaddle and place in a quiet, safe sleeping cot. 8. Are the conditions right for settling? Reduce stimulation. 9. Is she sick? Does your baby have a fever? 10. Do you need a break? Place baby in a safe place. Give baby to someone else to settle. 11. If crying continues, contact your GP, call a family member or friend, or call Parent Line. Immunisations save lives. They reduce disease, disability and death from a variety of infectious diseases. When babies are born, they are vulnerable to serious and life-threatening diseases. Babies are partially protected against these diseases as they receive antibodies from their mothers during pregnancy and via breast milk. But this does not provide full protection. In Australia, children are vaccinated against 13 vaccine-preventable diseases. The Childhood Immunisation Schedule aims to provide protection to babies as early as possible. Babies start receiving vaccines at birth, then again at 2 months or from 6 weeks, 4 months and 6 months of age. Immunisations must be given as close to the due date as possible to ensure continuous protection against these diseases. The app Vaxidate helps to keep track of when your baby's immunisations are due. The Healthy Hearing Program forms part of your baby's health check prior to discharge. The aim of the screen is to identify babies with permanent hearing loss. The screen involves placing small pads on your baby's head and soft earphones over each ear. Soft clicking sounds are played into your baby's ears and the pads record your baby's responses to the sounds. You will be given the results on the day of the screen. A pass in both ears indicates that it is unlikely your baby has hearing loss. It is important to remember that hearing can change over time, and if you have any concerns or your baby is not meeting hearing and speech milestones, you should contact your general practitioner or child health nurse. If your baby receives a refer result during the screening, a second screening test will be performed. If the second screen results in a refer, you will be referred to an audiologist for further testing. NNST is another newborn screening test that is offered to all parents. The test screens for more than 20 rare congenital disorders. If diagnosed early, disability can be prevented and the health of your baby is improved with treatment. The test involves collecting a small sample of blood from your baby's heel and placing a few drops onto a special paper. Parents are only contacted if there are concerns with the result. The test is performed 48 to 72 hours after birth. The establishment of a healthy parent-infant relationship in the postnatal period is important, as this affects the baby's physical, mental, and brain development. Bonding occurs when you consistently respond to your newborn with love, warmth, and care. Father-baby relationships have positive benefits for fathers and have been shown to improve child development outcomes. Contact between you and your baby should be encouraged during separation. This can be facilitated by sharing photos, discussing milestones, and participating in regular visits. During the visits, involve yourself in your baby's cares, changing nappies, feeding, burping, talking, reading, singing, stroking, and settling your baby. Try to build meaningful and positive connections with your partner. Talk to her about her feelings. Acknowledge the emotional impact that the incarceration has on you all. Explore programs that the prison offers to build and foster these relationships. Video visits, be involved with decision making, and make an effort to discuss family matters. This will help you to maintain your bond with your partner and your baby. Listed are some helpful websites and contacts that will be useful for you to access if you require further information or support. In conclusion, newborn behaviours and needs are wide and varied. You need to become familiar with the individual needs and behaviours of your own baby and discover what works best for you in your situation. You now have the knowledge and skills to safely and effectively care for your newborn. Being flexible and responsive to your baby will allow you to bond and form lasting attachment. There are many sources of information and help available to you as a new parent. Good luck on your parenting journey.